everybody. Thank you. Hello. Welcome to another episode of the Conan O'Brien Show. My name is Conan O'Brien, and I will be your host for tonight. Today, we have a very serious topic I'd like to discuss. It is ICU patients and the PTSD they suffer. So, as you all know, the ICU is the intensive care unit, and many of us have a family member or have been through the ICU themselves. But the PTSD and recovery from the ICU is something that is not discussed, and we need to bring further light to. Today we have a special guest, Dr. Daniil Kopilov, who will come on and speak to you guys about his research and what he believes about PTSD in the ICU. Tonight we have a very special guest. He's a lead in the field, and his name is Dr. Daniil Kopilov. Hey there. Hello. Thank you for being here.
Yeah, thanks for having me.
Please have a seat. So first question, could you please tell me about yourself?
Yeah, so I've been in the field for about 20 years. I've seen many patients come and go, and I'd like to explain the importance of PTSD. I prepared a little video for you, so let's start off with that, I guess. The topic that I will be discussing today is the ICU and the reintroduction of patients to society. First, I will discuss the history of the ICU and how it was implemented. Then, I will talk about the importance of PTSD as a result of the ICU, and conclude by talking about the physical impairments that patients suffer from. The initial ideas about intensive care stemmed to the 1920s, where wounded soldiers were treated. However, the first time the intensive care unit was officially recognized was in the early 1980s. Later, by 1989, the first research went into improving ICU patient care and outcomes. As of today, critical care utilizes science, new technology, and preventative care approaches. Although much research has been put into recognizing the advancements of the ICU, there are many failures when it comes to the mental health and the stability of patients upon leaving intensive care. Patients who are admitted to the ICU suffer from a 20% mortality rate. Upon leaving critical care, 30 to 50% of patients have long-term acquired weakness, and 30 to 80% have basic cognitive dysfunction. And the most alarming fact is that over 50% of these patients do not return to work after a year. The leading cause of these statistics can be traced to the mental sufferings of patients during their stay, but on a broader scale, patients also suffer from cognitive and physical impairments. It is also important to recognize that the patients are not the only people who suffer after leaving the ICU. The family members of these patients are also severely impacted. In a study done by Dr. Ko, 280 caregivers were followed for a week, 3 months, 6 months, and 12 months post-ICU. 43% of them experienced high levels of depression a year after. This alarming percentage is 31% higher than the general population of Canada and 11% higher than caregivers of patients with dementia. But the main focus of this research is PTSD from the ICU, which is a disorder of non-recovery from a traumatic event. But how do we determine who is going to suffer more from PTSD post-ICU? Researchers use the IPAT test, which stands for Intensive Care Psychological Assessment Tool. The purpose of this test is to identify post-ICU problems in patients very early. This is often administered to patients in the form of detailed questionnaires. Once discovered that a patient will most likely suffer from post-ICU PTSD, there are many aspects of recovery. These include screening, relaxation therapies, cognitive remediations, and educational interventions. More recently, the use of stress diaries have been incorporated to reduce the chances of post-ICU PTSD. This creative method allows patients to write down their daily thoughts and reduce psychological stress. Another aspect that is important to ICU patients is physical impairments. A study shows that muscle weakness begins a few days after admittance to the ICU. More specifically, leg muscle size decreases very quickly in the ICU due to immobility. By the third day, there's a 5% reduction in leg muscle size, and by a week there's a reduction of 15%. This means that within 7 days of entering the ICU, the strength of the leg muscle has severely decreased. This also means that patients who get weak during their ICU stay have a higher risk of death 1 year later. Studies show that the more muscle strength is maintained during critical care, the more likely a patient will survive. So the question is, how do we maintain muscle strength in patients who have difficulty standing up? The most effective preventative strategy that has been implemented as of today is the cycle program. The cycling program is created by doctors to improve the lower extremity strength of patients. In the hospital that this program is present, studies show that patients who participate in cycling improve their physical independence at time of discharge. Overall, an ICU stay can be potentially tragic, but through preventative measures that limit PTSD and muscle weakness post-ICU, individuals may become productive parts of society once again.
That was a really informative video. I'd like to thank you so much for being here and your efforts in the field.
Yeah, my pleasure.
So we'd like to go to a commercial break for a second. We'll be back, folks. So that was Dr. Dino Kopila. Next up, we have two very special guests, as they have suffered through the ICU with first-hand experience. First up, we have Priya. Thank you so much for being here.
Thank you.
And her husband, Cameron.
Thanks.
Thank you. So please have a seat. We are going to have a lovely conversation with you folks when we get back, but first, check this out.
In the summer of 2015, I was admitted to the ICU due to respiratory distress. During my visit, I was mechanically ventilated for 5 days. Even though I'm now physically healed, I don't think I recovered psychologically.
So, thank you for being here tonight. First off, I'd like to start off with a very basic question. So how was it in the ICU?
Honestly, it was so traumatizing. I couldn't get any sleep because of the medical equipment, which made me feel so tired, and I just felt like the whole process was so frustrating.
Start.
So, how would you say your physical health is at the moment?
Not the same. I used to be a marathon runner, so I try to go back into training. I feel like I don't have the endurance. My muscles so weak. I can't even get back to work, so it's not the same.
It's awful, man. So sorry to hear about that. But as a spouse, is there anything else that you have felt or you'd like to share?
Yes, I'd like to share that ICU doesn't just affect the patient. It affected me a lot. And I think that one of the most important things is that I've been depressed. I can't sleep at night because it reminds me of the days where the incident occurred and everything just went. And it's just terrible.
Are you okay? Would you like a tissue?
It's okay.
It's okay. It's okay. I'd like to thank you guys so much for being here. I'd like to thank the producers, the audience, and everyone at home. I would especially like to thank Dr. Neil Kopilov, who has brought this topic of PTSD and in the ICU and the people who suffer from it to the forefront and into our society. I'd like to thank everyone, and I hope you guys have a great night.
My name's Jason. I'm an arts major. And what did I think about the show? Well, I really enjoyed the conversation, but felt like you could have gone into a bit more detail about treatments post-ICU. You guys discussed how to prevent it during the patient's stay, but I would have liked to know a bit more about how patients recover from PTSD after they leave the hospital. Other than that, I thought it was well organized and well presented. The slides were well made and easy to follow, which made it easier for people like me that lack scientific knowledge. Overall, despite its shortcomings, I thought it was an excellent presentation.
Hi, I'm Aisha, and I am a medical researcher. What did I think about the show? I thought the show was very interesting, but I had some concerns with the content. So, for example, I was a bit confused about the cycling program. I felt like it could have been discussed a bit more. You guys talked about mental issues with ICU patients, but I felt like the cycling program was mentioned at the very end of the show, so I didn't really grasp what the major content was. And in relation to that, I felt the same for the 6-minute walk. You guys mentioned it really briefly, but I didn't really understand what that was about either. I know that it was a method of release from hospitals for patients, but I wish it was discussed a bit more. There was also a correlation discussed between the cycling program and the 6-minute walk. I wish that was discussed a bit more as well. Other than that, I thought the show was spectacular and I really did learn a lot.